Thank you, Rick, and I join others in expressing appreciation to the Policy Institute, Public Policy Institute at JU, and specifically Rick Mullaney for putting together this day. Quite frankly, this kind of convocation is so critically important. And also to thank you for being here and your interest. To me, when you come to discussing the Affordable Care Act, in particular in healthcare reform, it is that which is often misunderstood, and there's hyperbole about it. And so when people invest the time to better understand and to hear all perspectives, I have great respect for that. I also want to acknowledge the students who are in the balcony. We have the opportunity of seeing many of them as they come through our various healthcare institutes. And so thank you for coming and spending time with us as well. And it's always a pleasure to be on the stage with my esteemed colleagues. I always want to make this point every time I get up here, and that is there is a collaboration and a spirit of cooperation among healthcare organizations in our community, and specifically the chief executive officers, that literally is not paralleled across the state. And so I always value that. In fact, I'm so respectful of them that Jim and I decided we're going to kind of do the high level, set the context thing, and leave all the controversy to Moody and Russ and Bill. So I'm not going to say anything political or controversial during the context of what I have to say. What I am going to do is try to set forth what I believe are 6 or 7 implications for the healthcare delivery system of reform, and specifically the Affordable Care Act. Some of you have heard this before. Anytime you do it, there's always the danger someone's going to put this into the category of established truth. Let me assure you that that is not the case. These are my opinions, and hopefully will prompt discussion. I always use the Gretzky quote because, you know, what Gretzky said is you always skate to where the puck's going rather than where the puck is. The difficulty in this particular situation is we do not know exactly where the puck's going when it comes to healthcare reform. There's still a lot of pilot demonstration kind of things going on in the context of this law, but probably equally important is the fact we don't know how fast that puck is going to move. If we knew, when I talk about this implication, how rapidly this was going to occur, then obviously we would be doing something other than merely sitting on the stage today in terms of being people who could do effective prognosis for the healthcare system in America. So I'm going to set these forth. I'm going to do it rather rapidly. I've got some board members in the room who would question whether I can do anything rapidly, but I am. Number one is the assumption that change is inevitable. I mean, this is just my way of saying, because I believe this very strongly, that we're going to go about major transformation in the healthcare delivery system in this country, really regardless of the Affordable Care Act and its implementation. Or another way of saying that, because again, I believe this, the system as we know it is simply not sustainable long term. And that's sort of the jumping off point for me. Secondly, and this has been alluded to already, there are going to be changes to the healthcare delivery system and specifically to the payment methodology for those of us as providers. It is inherent in the Affordable Care Act. Although much of this is still in the form of pilot or demonstration project, I use the word experimentation at times, and it really warrants further monitoring as we go forward to see what is proven to be working across the country as these various pioneer ACOs and other kind of bundled payment projects are implemented. What we do know is that pay for performance is here to stay. It preceded the Affordable Care Act, but it is also an integral part of the Affordable Care Act, whereby we are going to be rewarded for outcomes and in our payment penalized for not so good outcomes. To learn which of the other kinds of payment methodology changes will become predominant in the system certainly is that which we don't really know yet, nor the pace with which it will occur. So, you know, I put 3 other things here. I mean, I'm saying the obvious, the shift from volume to value that's already been alluded, whereby we are not going to be rewarded in the future for simply doing more. That also entails a certain financial shift toward providers, and I think that needs to be emphasized. It also clearly means we're moving away from the current fee-for-service, that way by which we are paid every time we provide service or there's an encounter with the system. We are moving to models that take us away from that. Again, exactly where that's going, we're not sure. And I think the other point that perhaps needs to be emphasized is that this is all going to necessitate a better coordination of care across the continuum. The silos by which providers operate in their own independent way really is going to go away and give way as these payment changes are implemented. So for us as hospital executives, all of this is going to necessitate hospitals to pay much greater attention to the post-acute care, to that which happens after patients are discharged from hospitals, to ensure their continued good health, and certainly to avoid readmissions to what is one of the most expensive components of the healthcare system. Number three, and this has already been said by Pat and others, consumerism is going to rise. There's going to be greater demand for transparency related to price and outcomes, as well as regardless of how you want to define outcomes. You know, healthcare has just remained a dark hole for consumers. They've been, and many of you would say this is true of yourselves, have been finding it very difficult to understand, much less compare prices or outcomes as they make choices. This has already been occurring, but it is going to be accelerated by the Affordable Care Act with the creation of more robust individual markets and certainly the creation of the exchanges. Number four, that necessarily leads to there's going to be greater accountability for performance on the part of all of us as providers related to quality, patient safety, patient satisfaction, and cost. I mean, that follows from the previous two assumptions that payment methodology changes the incentives and rewards performance. Consumers will be demanding performance and transparency in order to compare. And then number five, there's going to be greater integration of the components of the healthcare system. The current fragmentation, the silo-like nature of healthcare providers is going to go away. You already see this happening as health systems have acquired physician practices. In some cases, healthcare systems are announcing they're going to create managed care plans. In other markets, health plans are acquiring physician practices, as Florida Blue talked about in the Tampa Bay area. And even in some cases, in the Pittsburgh area, health plans acquiring health systems. So the consolidation and integration, I would predict, is going to continue in this post-reform era. The real question is who and what market is going to be the integrator or the bringing together of the pieces of the delivery system. I should add real quickly that the recent announcement that we made of the affiliation of Abdus Flagler and St. Augustine and Southeast Georgia Medical Center in Brunswick is kind of another example of that integration as community-based, not-for-profit hospitals come together in forming some contiguous kind of health network, in this case along the Northeast Florida, Southeast Georgia. This kind of trend obviously is going to continue. The other point that's really not been made today, and that is there's going to be a major shortage of physicians and clinical staff. It's really kind of a perfect storm. First of all, the combination of expanded coverage that will occur with the Affordable Care Act, placing new demand on the system with the influx of individuals. But then there's also, as already been alluded to, the demographic changes as the population ages. We all know that older people, and the older they get, utilize health care to much greater extent. And then the third factor is the aging of the workforce itself. You look at the age of nurses, you look at the age of physicians, we have many pending retirements that are going to occur. So with the increased demand on the system and the shortage caused by people leaving the system in terms of providers, there's a serious issue about the shortage of physicians, nurses, nurse practitioners as we go into the future. And that's certainly, using Ford's analogy about Massachusetts being the one place where we have a little bit of predictability. That's been true in the state of Massachusetts, where there were more primary care doctors per population than any state in the union. When you had this expansion of coverage, there was a shortage of primary care, waits for primary care almost overnight. And if that was true in Massachusetts, where they already had more primary care doctors per population, how much more is that going to be true in the rest of the country? And then I always like to end on a positive note, but not meaning to be just Pollyanna, and that is that I really do believe the healthcare system in this country is going to remain vibrant even in a post-reform era. I'm not trying to be just overly optimistic. When I entered this business in 1984, every hospital executive was bailing out because of the implementation of DRGs. This was the end of the world as we knew it. And there's a real danger as we look at this that the healthcare system, the sky is falling, and this is the end of the world as we know it. I simply don't believe that. I still believe we deliver the best healthcare in this country. If I'm sick, I want to be in this country. And quite frankly, if I'm sick, I'd want to be home in Northeast Florida because we have outstanding healthcare providers. And I think the group of people up here are committed in the future to be architects of change, even in the midst of this turbulence and change, and end up with an even better and more responsive healthcare delivery system, even in a post-reform era. And so on that positive note, I'll let Moody introduce some controversy.